Very good afternoon to all. Today we are going to discuss regarding one of the important topic in community health nursing, that is levels of prevention. The content of topics are introduction, prevention, levels of prevention including primordial prevention, primary prevention, secondary prevention and tertiary prevention. We are all heard a famous proverb, prevention is better than cure. This proverb says that the action has to be taken prior something happened. In today's world, during this COVID pandemics, we are maintaining social distancing, wearing masks and sanitizing our hands before and after any procedures in order to prevent the disease in order to getting the diseases. So, we can apply this proverb to our topic, that is levels of prevention. We can see the definition of prevention. The definition of prevention, that is the activities designed to protect patients and their members of the public from actual or potential health problems. The activities has to be taken or prior something happened to the public from actual or potential health problems. Next is the levels of prevention. The levels of prevention include primordial prevention, primary prevention, secondary prevention and tertiary prevention. In primordial prevention, the emergence of risk factors, in order to reduce the emergence of risk factors. The second is primary prevention. In this prevention, we have to avoid the disease conditions. To avoid the disease. Then in secondary prevention, in order to prevent the emergence of complications. To prevent the emergence of complications. In tertiary prevention, we have to prevent the emergence of disabilities. In primordial prevention, we have to prevent the emergence of risk factors. In primary prevention, we have to prevent the diseases. In tertiary prevention, to prevent the emergence of complications in tertiary prevention in order to avoid the emergence of disabilities. So, next we can see every prevention in detail. In this primordial prevention, it is the prevention of emergence of risk factors in population in which they have not appeared. For example, in school days or college days, we have to educate the students regarding in order to avoid alcoholism, drug abuse in their daily life. So, like education given in individually and mass education. So, these are the intervention in primordial prevention. That is, the main intervention include individual and mass education. For example, we have to adopt a new healthy life patterns, include food and nutrition, and the policies for discouraging smoking, alcoholism and drug in order to promote the regular physical activity and in order to make the changes in daily life to promote healthy lifestyle changes. The next is primary prevention. In the primary prevention can be defined as in order to avoid the diseases. So, the action has to be prior the onset of disease, which removes the possibility the disease will ever occur. The action are taken before the onset of disease. For in middle age, that is in the age of 30 to 35 ages, the person can have in order to prevent if the person cannot following the adequate lifestyle. So, the person can prone to get the diseases like diabetes mellitus, hypertension, etc. So, in this level, we have to prevent the onset of diseases through the health promotion and specific protection activities. In this health promotion include, we have to avoid the environmental factors and our daily life attitude like good diet and good regular physical activity in order to prevent the diseases. Then specific protection include vaccination. So we are taking vaccination for in order to prevent the COVID-19 during this pandemic, and also we are giving vaccination immunization to the childhood in order to prevent measles and other vaccine preventable diseases. It's included in specific protection. So the intervention include in primary level prevention, immunization, use of specific nutrients in order to prevent the nutrition deficiency disorders, and chemoprophylaxis. For example, tab doxycycline taken to prevent leptospirosis after flood. Then the protection against occupational hazards. In occupational factory, in occupational factories, the persons are wearing masks and goggles in order to prevent the occupational health hazards. Then protection against accidents, the measures to taken, the control of general environment, then avoidance of allergens in specific seasonal conditions. These are the interventions including primary prevention. The next level of prevention is secondary prevention, the action which halts the progress of the disease and the prevent complication. In middle ages like 45 to 60 years, the person, if the person has not any screening any diseases like diabetes, the person cannot do any screening measures like diabetes mellitus, for hypertension, they didn't take any medications regularly or any following any physical measures for diet and exercise, the person getting this disease complicated. So with this level, the mode of intervention include the early diagnosis and treatment measures. For example, screening tests for diseases like pap smear for cervical cancer and breast self-examination in order to early diagnosing of breast cancer. So these are the examples of secondary prevention. Then next example is telling the people to take daily medicines, low dose aspirin to prevent heart attack or stroke, then recommending regular screening tests. These are the measures, these are some examples for secondary prevention. Then the fourth level is tertiary prevention. In tertiary prevention, if the person has not followed the secondary prevention activities, the person leads to the disabilities. That is, if the patient has a stroke, so if the person cannot follow the primary, secondary activities, the person will be turned into the tertiary level. So in this level, the main intervention include disability reduction and rehabilitation. So the tertiary prevention is defined as all the measures available to reduce or limit impairment and disabilities and to promote the patient's adjustment to the irremediable conditions. So the intervention include the disability limitation and rehabilitation. So the interventions are in primary level prevention, individual and mass education, in primary level include specific protection and health promotion, in secondary level include early diagnosis and treatment, in tertiary level include disability limitation and rehabilitation. Disability limitation and rehabilitation. So far we discussed regarding the levels of prevention. The levels of prevention can be divided into 4: primary prevention, primordial prevention, primary prevention, secondary prevention and tertiary prevention. Hope you all understood the topic. Thank you.